All right, welcome to The Explainer. Today, we're diving into a true marvel of biological engineering, the literal pillar that carries every single one of us through life, the femur.
I mean, just think about it for a second. Every step you take, every time you even stand up, this one bone is the absolute superstar of your body's infrastructure. It's the whole foundation of how you move. But there's a really fascinating contradiction right at its core.
And that's the big question we're going to tackle. We're going to break down how the femur is built for incredible, almost unbelievable strength. But at the same time, it has this critical design trade-off that makes it uniquely vulnerable. Okay, let's get into it.
So first things first, let's just establish how ridiculously impressive this bone really is. It is truly in a league of its own. On average, we're talking about a bone that's around 18 inches or 45 centimeters long. And to really put that into perspective, this one bone, it makes up roughly a quarter of your entire height. That's a massive piece of our anatomy. But you know, it's not just about size. The femur is, without a doubt, both the longest and the strongest bone in the human body. Its main job, to channel your entire body weight from your hip all the way down to your shin every single time you stand. It's an absolute workhorse.
Now let's go up to the very top of the femur where it plugs into the hip, because this is where we find that brilliant and kind of flawed piece of engineering. Have you ever wondered about that? Why doesn't your thigh bone just go straight down from your hip socket? Why does it angle inward towards your knees? Well, the answer lies in one very specific feature.
It's something called the neck shaft angle. So instead of a straight line, the head and the neck of the femur jut out from the main shaft at about 125 degrees. And believe me, this angle is everything. And right here, you see this classic engineering trade-off in action. On one hand, the benefit of this angle is huge. It gives our legs an incredible range of motion, letting them swing clear of our pelvis when we walk and run. But on the other hand, the risk is just as big. This angle creates a massive stress point right at the neck of the femur, making it one of the most common places for fractures, especially as people get older. It's a perfect compromise between mobility and stability.
So, if the neck is a potential weak point, how does the rest of the bone handle all that force? Well, let's move down to the shaft, which is built like the ultimate support beam. The source material gives us a great clue here. It says there's a feature on the back of the femur that functions as a buttress. But what does that actually mean?
Think about a big old Gothic cathedral. You know those massive stone arches you see on the outside walls? Those are called flying buttresses. Their whole job is to reinforce the walls and keep them from collapsing. Well, guess what? The femur has its own version of that.
So there's this thick ridge of bone running down the back. It's called the linea aspera, and it basically acts like an internal I-beam. It runs down the length of the shaft and gives it incredible resistance to all the bending and compression it deals with every day. It's pretty much nature's own rebar.
And this incredible support system goes all the way down to the knee. You see, at its lower end, the femur doesn't just stop, it transforms to help create one of the most important joints in the whole body.
The bottom of the femur flares out into these two large, smooth knobs called condyles. This wide base creates a super secure and stable platform for the knee to bend on. It's also the main anchor point for the crucial ligaments that hold that whole joint together.
And here's a fantastic little tip for you. Remembering which knee ligament attaches where can be a little tricky. Just remember the mnemonic LAMP. The lateral condyle is for the anterior ligament, and the medial condyle is for the posterior ligament. LAMP. Simple, right? But incredibly useful to know. Okay, so we've seen the strengths, we've seen the clever design, but now let's circle back to that flaw we talked about and see what happens when the whole system fails.
Because a femur fracture, especially up at the neck, isn't just a broken bone. No, it's the start of a potentially catastrophic chain reaction. The real danger is what happens next. When a break happens inside the hip joint capsule, it can actually sever the tiny arteries that feed blood to the head of the femur. And without blood, the bone tissue can't heal. It starts to die. This condition is called avascular necrosis, literally bone death, and it's what makes a broken hip so incredibly serious.
But to wrap this all up, the femur holds one last incredible secret. And it's a story that doesn't start in old age, but begins before we're even born. Ossification is just the process of cartilage turning into hard bone. Now, the femur's timeline for this is amazing. Most parts of it harden well after birth, but look closely at the lower end. That part starts to turn to bone right around the 9th month of fetal life.
And here it is, the final mind-blowing fact. The presence of that specific little piece of hardened bone at the knee is actually used in forensics. It's a medical legal indicator. It's evidence that a fetus was carried to full term. The femur literally starts telling our story before we've even taken our first breath.
So, you see, the femur is so much more than just a bone. It's a story of evolutionary trade-offs, of incredible strength and calculated risks. It's a structure that supports us our entire lives, and at the same time holds the very first forensic clue to our own existence. What an absolutely remarkable piece of who we are.